It gives me great pleasure to extend you a warm welcome on behalf of Dr. Carissa Etienne, our director, and all of us here at the Pan American Health Organization, World Health Organization Regional Headquarters, and to express our gratitude for those of you who have accepted our invitation to convene in this important webinar on the appropriate use of antibiotics in sepsis, timely action that saves lives. As you may know, this week marks the World Antibiotic Awareness Week for the year 2017, which is part of a global effort to combat the persistent emergence of antimicrobial resistance, or IMR, a phenomenon of great relevance that has the potential to hinder effective infectious disease management and control. Antimicrobial resistance is of especially grave concern in low and middle-income countries, such as those we have in our region. A high infectious disease burden combined with an unconstrained access to these agents further complicates the problem. And within this context, sepsis, which may be the most burdensome form of infection pathology and represents a vital indication to move towards the responsible use of effective antimicrobials for human health. It is complex to estimate precisely the global epidemiological burden of sepsis. However, a systematic review conducted in 2016 estimates that approximately 31 million new cases of sepsis and approximately 24 million severe sepsis cases occur each year. Many of these patients die without need or suffer permanent health sequelae. In fact, clinical conditions resulting in sepsis account for close to 6 million deaths annually. Sepsis is also a major cause of maternal and neonatal morbidity and mortality in low and middle-income countries, contributing to around 1 million of newborn deaths and 35,000 maternal deaths annually. Limited access to quality healthcare, maternal and neonatal immunization, overcrowded and poorly resourced health facilities, and unnecessary cesareans are few of the factors that are contributing to this increasing burden. Antimicrobial resistance is a major factor determining clinical unresponsiveness to treatment and the rapid evolution to sepsis and septic shock. Approximately 214,000 neonatal deaths due to sepsis worldwide each year could be attributable to resistant pathogens, and sepsis patients with resistant pathogens have been found to have a higher risk of hospital mortality. Realizing that in the absence of appropriate and timely clinical management, sepsis will be almost universally fatal, the World Health Assembly in May 2017 approved a resolution on sepsis aligned with the Global Action Plan on Antimicrobial Resistance. All 5 principles of the Global Action Plan are relevant to reducing the burden of sepsis worldwide, which will be discussed in this seminar. Currently, all levels of the organization, including PAHO, are working with member states to implement the Global Action Plan through national action plans and related activities. Given that the occurrence, frequency, and fatality of sepsis are determined by complex interplaying factors related to the host, the pathogens, and the health system's response, a coordinated institution-wide effort is necessary to mitigate the morbidity and mortality of sepsis in the world. As I mentioned, just in May of this year, the 17th World Health Assembly approved a resolution on sepsis. Hence, the relevance of this seminar to raise awareness on the problem and the required actions to tackle it. This necessitates the prioritization of strategies to address this public health concern by addressing several issues that you will be discussing today. In closing, I would like to thank you for your participation in this very important discussion and your potential collaboration in our efforts to mitigate the burden of sepsis in the region of the Americas.